When you're facing a medical emergency, finding the right doctor is critical. So when 14-year-old Krista started having excruciating headaches, her family didn't stop until they found the right specialist.
When Krista was 10 years old, she had a 10-day-long headache that was just relentless. When they did the MRI, they noticed a cyst. They really didn't attribute the headaches and things to that cyst. They said, you know, you must have had a virus, but while we were in there, we found this cyst and we should keep monitoring it.
Because since that, everything's just been a disaster.
First she loses her vision in her left eye, then her vision starts to go in her right eye. Her body feels like it's on fire.
It feels like burning bee stings, almost like venom is traveling through your body.
We start seeing every kind of doctor in the book.
I've been to probably 20 to 40 doctors.
Pain management doctors, rheumatologists, neurologists. He was tested for cat scratch fever, MS, every sort of demyelinating condition.
I've gotten spinal taps, countless numbers of MRIs.
We're asking them, could this have anything to do with the cyst? Some doctors will say, maybe. Some doctors will say, no, no way.
It's just like nobody knows what's going on, and it's just been so hard finding the doctors, the correct ones. It's been a roller coaster.
She was not afraid of being sick. She was afraid of being alone. And she wanted people to help her feel better.
The scariest feeling is not knowing.
The moment everybody agreed that the tumor needs to come out was the latest MRI where it had significantly changed. Then the big question became, how's it going to come out?
The scariest thing I've ever heard in my life was that I had to get brain surgery. It's not something you want to hear when you're 13.
The tumor is located in the pineal region of her brain, which is the exact center of her head. It's the most dangerous brain surgery there is. So many doctors say there's no way that they could do it.
Krista's parents, Heather and Bruce, are joining us now. Thank you both for being
Thank
here.
you.
So Heather, as a parent, you want to do everything you can do in your power to make sure you get the best possible medical solution. And at this point, what options were you left with?
Well, when we met with an oncologist and he said, look, if this was my child, I'd get it out in a week. This needs to come out. And we said, what do we do? Because we don't know how to get it out. He said, find the top 5 best pediatric neurosurgeons in the United States and go ask them. So we did it.
Our concern is we knew we had to do something, was just trying to find out what that answer was.
After months of research, Heather and Bruce finally found a skull-based surgeon who developed a new cutting-edge surgery that might help Krista. But warning, some of this footage is graphic.
Good morning. You ready for this?
Yes.
See this space here? We're gonna let the fiber optic travel like this and drop on this guest here. And this is what we're gonna take out right there.
Okay.
All right? This is the back of her head.
The whole surgery is going to be done through this incision. We're going to make a dime-sized opening in the skull. So we're thinning it out a layer at a time. Of course, a 13-year-old has a little bit thinner skull than an adult, so we have to be extra careful. Did you hear that pop? You can see the brain is pulsating. The key now is going to be to drain some of the brain fluid to make space for us to do the work. Okay, so now we are gonna do the endoscope. This is her left cerebellum. This is her right cerebellum. We're gonna insert the endoscope in and slide over the cerebellum. Now we're advancing the endoscope. So the pineal is gonna be behind this area. So now starts the dissection. See that yellowish thing down below me? That's what we're trying to get out. Like, you gotta take your time and really peel it because it's surrounded by blood vessels. One wrong move and, you know, you have a big problem. Okay, tumor's coming out. That's the last portion of it. The tumor is out completely, every bit of it. The pathologist did confirm that this is definitely a solid pineal tumor. So this was the right thing to do, and I'm glad we were able to take this tumor out.
That is an amazing operation, and we are very blessed. I want you to welcome here skull-base surgeon, Dr. Harar Shahinian from the Skull-Base Institute here in Los Angeles. And that surgery was really cool to see, and I think it helped people realize why this is such a difficult area of the brain to get to.
Correct.
This is as deep as it gets.
This is as deep as it gets. This is where the tumor is, in the deepest recess of the brain.
This is the pineal region. And so you have this new procedure versus the old way. And let's show the old way versus the new way on this really cool animation that we have. Walk us through this.
This is the old way, where you spend hours drilling large portions of the skull. Sometimes 5-6 hours of drilling. Then you put metal retractors to either push the brain or sometimes even go through normal brain in order to get to the tumor. This procedure typically takes 8 to 9 hours. You use some fat to block the leakage of brain fluid. This is the new technique, done in 2.5 hours, just like in this case. Patients leave the hospital within 2 days, and the tumor is taken out completely through a keyhole, very small opening, with the help of a fiber optic, high definition, very small scope.
So the pineal gland is now gone entirely.
This tumor is gone completely.
In fact, let's show everyone. We have a before and after as far as MRIs of Krista's brain. Highlight for us where the tumor was in the before MRI image.
This is the tumor.
And again, this is in the very middle of the brain, and then this is the after, and what's missing?
This is what's missing here. It's gone completely.
And you know, this has been such a journey for Krista and her family, but we are very lucky. Krista is here today. Are you all ready to meet her? Please welcome Krista to the show.
You get the bows like this.
Yeah, you get bows. You get. So have a seat.
You look great, Krista.
Thank you
Did
very
your
much.
symptoms literally go away right after the surgery?
Yeah, I woke up after surgery, and I remember this really vividly, but I, could see, and I had a headache for so long that was so bad I didn't know I had a headache anymore.
So it had become normal to hurt.
Dr. Shahinian, who is a candidate with the techniques that you have available to you?
Well, the youngest patient we have done is 4 months old, and the oldest patient we have done, I believe, is 87 years old. I don't think there is any limitation in terms of age or size of the tumor. She had a solid pineocytoma, which is a benign tumor of the pineal gland, thankfully.
Well, and thank you so much. Krista, you look great. Thanks for coming on the show. Thank you as well.